Good morning. Welcome to day one of the Home Health Quality Reporting Program Provider Training. I'm Mark Stewart with Econometrica. I have colleagues in the room who are wearing yellow shirts. We ask that if you have any questions or need any reasonable accommodations, to please either see me or a colleague in a yellow shirt. Along the lines of reasonable accommodations, to my right, the far left of the room from your perspective, is a screen with closed captioning, which will be provided live for both days of the training. If you'd like to read the closed captioning, please have a seat at the table marked reserved in front of the screen. We ask that you please ask questions of myself and the yellow shirts and not the staff in the room who are taking care of the audiovisual, including the closed captionist. As you can imagine, works very hard to capture every word spoken today. Bathrooms are located outside the room and to the right. Parking is free. However, if you're in the garage, you need to be alerted that you pay per exit. If you stayed at the hotel, you may log on to the Wi-Fi that you used in your guest room. If you did not stay at the hotel, you may access the Wi-Fi with the instructions that are on the table. You'll choose Intercontinental Dallas Meetings, click on Have a Conference Code, and then enter the code HHQRP. There are three ways to ask questions throughout both days. The first is related to having Wi-Fi access. There are instructions on the table on how to submit questions online. We encourage you to use this platform. This allows us to pass the questions immediately to the presenter and have them consider a response. Please only submit one question each time you log on to the site. It'll ask for your name, organization, the section code, and then the question. When you click submit, you'll receive a confirmation screen and an opportunity to ask an additional question. You may also ask questions using a card on the table. We'll be around throughout both days to collect the written questions on the cards if you prefer to not use the online access. A third way that you may ask questions are at the microphones in the room. When you ask a question, please state your name and the organization that you represent. That's very important because we're joined by more than 800 people who have registered to view the training online. For those of you who are watching online, there's a link at the top left of the screen that says Attention Viewers. When you click that link, you'll have access to the questions. All of the materials are also online. They're in a zip folder, and they're numbered by presentation. So as each speaker presents, we'll alert you to which folder to refer to. I get to be Captain Obvious and state for you that you'll notice that none of the questions contain the answers. After the training, you'll be provided with a complete slide deck that contains all of the correct answers, should you wish to use that with colleagues back home. This is the agenda for today. I'm going to call it Pressure Ulcer Day. And I should alert everyone that you have an agenda in the folder at your table that will be used by the viewers online. Because we have such a large web presence, we will be sticking to each of the time frames. So it could lead to an adjustment with the breaks, but please be aware that, especially if you're watching on the web, we will start at the correct times. These are the speakers who you'll hear from today. Stace Mandel will be giving the official welcome on behalf of CMS. You'll also hear from Nicole Keene Ann Spinard, Ann Olson, and Kathy Roby, mainly on pressure ulcers, and I'll introduce each speaker before they present. The first speaker today will be an overview of the Improving Medicare Post-Acute Care Transformation or Impact Act, which will be given by Stace Mandel of CMS. She works with the Quality Measurement and Value-Based Incentives Group, or QMVIG, as we say in the DC area. She has more than a decade of public service, including with the United States Army, has been at CMS since 2009, and studied at both State University of New York, Stony Brook, and San Francisco State University. She and her presentation are labeled number 2 in the zip folder for those of you viewing online. Folder number 3 is the Home Health Quality Reporting Program Requirements, Definitions, and Assessments, which will be given by Nicole Keene of APT Associates. She's a registered nurse, has been at APT since 2014 as a nurse researcher, has experience with the Agency for Healthcare Research and Quality on catheter-associated urinary tract infections, and currently serves on the National Quality Forum's Measure Incubator. First will be Stace.